we're going to review a little bit what evidence exists about this disease, and mainly in the treatment. Etiology, as we know, is totally unknown, so for that reason we call idiopathic, and this is the cause most common of flu in cats, even more than 50% present this disease in comparison to another disease. Could be, this disease can have two presentations. One of them is acute, that is the more common, when the cat comes to us blocked, and another form is the chronic feline cystitis. The diagnosis is always for exclusion, okay? And I don't know if you remember in the past, this disease was called feline interstitial cystitis. Why this name? Because this disease is very similar to the interstitial cystitis of women, okay? But when another study compared the histopathology between what's happening in women and what's happening in cats, it was totally different. And for that reason, this name actually is not a good option. About the prevalence or frequency, the different type of cystitis, we can see in this table that non-obstructive is more common than we thought, okay? And what happened? Probably the owner don't see the clinical sign when the cat presents feline idiopathic cystitis, mainly in female cat. Another one is the recurrent form. Recurrent form could be, maybe there is different study, but the tendency is to be low prevalence, and that's cat that the recurrence can be every 2 months or every month, and sometimes we can confuse with the persistent chronic cystitis. This is another form of cystitis, and this one, the chronic or persistent or recurrent, needs special treatment sometimes. What is the risk factor? We have mainly the patient factor. This disease ranges between 1 year old to 15 years old. It's more common in young animals, probably for the stress, even less than 7 years old. And there is not a predisposition. And our experience, and according to the study, is more frequent in males than in females. Another thing that we have seen in all the study is more common in sterilized patients. In the past, one of the things that everybody thinking was that when you castrate a young cat, the side of the urethra was small, but a recent study doesn't improve that the urethra is normal when you sterilize a cat when it's young, okay? Another thing that is very important is the overweight. And the overweight is alongside the sedentary lifestyle, and that depends of us and depends of the owner. And you can see mainly in stressful cats, okay? There is another factor like environmental. Here is very important the modification, multimodal environmental modification, and where we find a cat with cystitis. In a multi-cat household, indoor cats, scan access to the high places, depends on the type of the litter. Mainly the camping litter is more frequent to produce, or that the cat is associated to the idiopathic cystitis, okay? That is the bold letter, that is their evidence support that. But there is another stuff that we have to consider. Maybe the litter tray is not quite on a safe area, food and water is not in a safe area, and conflict with another cat in the house. That is very important, the socialization inside of the cat, because influence over the stress and behavior of the cat. And more important, no hunting behavior has been associated, but it's not so strong the evidence, but it's another thing we have to consider when we treat a cat with feline cystitis. Another group of risk factor is the nutritional. dry diet is most associated with feline cystitis, low water intake, and when the owners do a frequent changes of diet that can produce stress for the cat, and this produce finally the chronic cystitis. What we know about the pathophysiology, we know that it's multifactorial. Is it the brain implicated in? Is it the bladder implicated? We're going to talk a little bit about the pathophysiology. What's happened in a normal cat that responds adequately to the stress? Sorry. I'm putting the last comment. Sorry. The chronic stress, what's happened? Stimulate the hypothalamus for produce a corticotropin releasing factor, and this corticotropin releasing factor exerts positive feedback over the pituitary gland and over the lucus ceruleus. The lucus ceruleus is that can produce norepinephrine, okay, and epinephrine. And the weight of the pituitary gland, the anterior pituitary gonna produce ACTH, and this CTH gonna stimulate to the adrenal glands to produce cortisol, okay? And this cortisol exerts a negative feedback over the pituitary and over of the hypothalamus to try to calm down or decrease the response of the stress. And the other way is in the lucus ceruleus. The body produces norepinephrine, epinephrine, and this can activate the sympathetic nervous system, and this stimulates the bladder, even can produce increase of permeability of the bladder. What's happened that cortisol that a body is producing in the cat can exert a negative feedback over the lucus ceruleus. That's happening in a normal cat. What's happening in a cat with feline idiopathic cystitis? Okay, this cat, everybody thinking that is not prepared adequately to respond to the stress. Bad, okay? And what happened? When this cat produces cortisol, this cortisol is low. It's within the normal limits, but it's low, okay? And this level of cortisol are unable to exert a feedback negative over the pituitary line and over the hypothalamus. And for that reason, all the time is producing ACTH and is producing norepinephrine and is producing all the time epinephrine and norepinephrine, and can produce all the changes that we're gonna see on the bladder. What's happening in the bladder? Okay, we have talking about that the stress, mainly the sympathetic nervous system, can produce increase of the permeability of the urothelium, okay? And this increase of permeability increase the numbers of the C fiber. Where are the C fiber? I fiber that control the pain, mainly the neurologic pain, okay? And this cat, we don't know why, this number of fiber is increases. What's happened? The substance P is released, and this substance P gonna stimulate more substance P receptor and can produce pain, vasodilation, vasculitis, submucosal edema, smooth muscle contraction, and mast cell degranulation. We have to remember that the cat, this is a mast cells species I call, because you can find a lot of mast cells in a cat. And one of the places that we can find this kind of cell is in the bladder, mainly in the urothelium, okay? What's happening in the cat with cystitis, or idiopathic cystitis, is increases in number. That was proved time ago, and this increase of number of mast cells can produce a degranulation and release histamine, heparin, serotonin, and cytokine, and prostaglandin. And that's, for own way, stimulate as well this fiber C, okay? What clinical sign we can find? All of us know the clinical sign. In the obstructed cat, you can find normothermia, trypothermia, shock, dehydration, heart rate normal to bradycardia, marked bladder distension, possible painful on palpation, but when the cat comes in shock, you can see that. And congested penis all the time. It's very important to check the penis. This is one of my patients that the penis is blue, is congested for the leaking. Sorry. And congested. And alopecia around the penis, apathy, anorexia, and vomiting. Okay? And we have in another side the unstructured cat. And this cat can present dysuria, stanguria, polyuria, hematuria, focalization, excessive leaving of the penis or vagina, alopecia of the caudal abdomen. That is important and is uncommon, but you can find alopecia in the caudal abdomen, and you can see, or you can think that this cat presents an alopecia for allergy, for fleas or something, but you have to consider this in your differential diagnosis, okay? Apathy and anorexia. What test we have to do? Well, I have tried to summarize a little bit that the test we need, but where I am working right now, we do all blood works, I mean all the tests. So you can do a CBC, you can do complete blood chemistry, urine analysis, with or without urine culture and sensitivity. This is a little bit discussed or because this is presented mainly in young animals. And what age is the most common when a cat presents an urinary tract infection? Older than 7 years? What is most common? Younger, but the UTI is more frequent in younger or old cat? In old, okay? Mainly you have to think about the CKD, and the CKD decrease the urinary specific gravity, okay? And that's predisposed to infection. So sometimes it's not mainly mandatory to do a culture, okay? I do a culture because I am working in a referral case and all the cats have been catheterized before many times, and many of these cats present some secondary urinary infection, mainly for the management, okay? And what image you have to do? You can combine, all the time you have to think that X-ray is complementary to ultrasound, not one replaced to another one. That is important to think about it, okay? And the first option is to do X-ray, okay, abdominal X-ray. And in this rate you have to include the penis, okay, the return penis, to try to rule out that there is no depression or calculi, okay? And you can do an abdominal ultrasound, okay? What do you think? Probably, if I have to choose, depends on the how much money can afford the owner. I can choose the X-ray and explain all the stuff that can miss. And if I can pay the owner an abdominal ultrasound but not X-ray, I prefer to do an abdominal ultrasound, okay? What is important, when we went to our clinic come blocked cats, we have to try to stabilize before to take all sample or make an ultrasound, because sometimes if you lost more time to doing test, the patient can die, okay? So it's very important to stabilize before to do all the tests. All the time, at the same time, you have to consider to use the ECG, okay? We monitor, mainly for the arrhythmia can be produced for the acidosis or can be produced for the hyperkalemia, even the bradycardia, okay? And in obstructed cat, if you can do it, you can do, or I try to do all the time, is blood gases to evaluate the acidosis. This is a table mainly to what is the essential to do to arrive at diagnosis, and what is your different diagnosis depends on the clinical signs or presentation of the cat. Mainly, if you want to take a picture, you can do it, but when we have a chronic cat, it's mandatory, or cat with a chronic clinical sign, it's mandatory to investigate and to do more and more tests. How we treat an obstructive cat? Okay, all the time we have to consider first the hypovolemic shock. Okay, what kind of fluid do you prefer to use? Ringer lactates, sodium chloride, push up your head. Ringer lactate and chloride. No one chloride, okay, perfect, that's like. I mean, yes, the best option is to do the Ringer lactate, but all the time, in the past, people tell us you have to be careful because the Ringer lactate has potassium, okay? And a cat comes with hyperkalemia, and that could be dangerous, mainly for the bradycardia and the arrhythmia, okay? But there are two studies that prove that isn't it, okay? In this way, it's better to use Ringer lactato because in this study, compared to sodium chloride and Ringer lactato, lactate decreased the hypokalemia when you this block to the cat almost to the same time. And we have to remind that Ringer lactate has a tampon substance, and this is better for the acidosis. And what happened with the sodium chloride can increase the acidosis, okay, or worsen it. So for that reason, it's better to use Ringer lactate, okay? How we manage the hypotension? We do crystalloid bolus at 10 to 20 milliliters per kilogram over 15 to 30 minutes, and you can do mainly till or up to 3 consecutive boluses, even 4. But if you don't see any kind of response, you have to do another substance or another drugs, like or such as norepinephrine or fresh frozen plasma or frozen plasma. Okay. What's happening with the synthetic colloids? It's not so much recommended because in human beings have been associated these starch with the kidney failure. Okay, so I try to not use these fluids. What is important? We need, when we unblock the cat, we need to decrease quickly the levels of potassium or creatinine, and for that reason it's very important the rehydration. Okay, the rehydration you can do in between 4 and to 8 hours. Okay, but more important, rule out our heart murmur when you rule out the heart murmur, or even if you hear a heart murmur, you need to do an echocardiogram echocardiogram to do a heart disease. What happens when you unblock the cat and the cat is catheterized? You have to replace, and it's hydrated, you have to replace the fluid according to the urine output, okay? But you have to consider that in the third talk, we're going to talk that produce an polyuria post-obstructive, okay, or post-obstructive polyuria, okay? But we're going to talk later about that. Hypothermia. When you have a cat with a severe hypothermia, mainly 36.5, you have to be active, increase the patient temperature. You can use red lamp, you can use hot water bottle, warm sandbags, blanket, but be careful with the ones, okay? Right? Because sometimes that can happen. okay, the burns. And how we treat the hyperkalemia? When a cat presents a mild hyperkalemia, that is, you can find the levels, only the fluid is okay, and probably in 4 hours, 6 hours, that's potassium. If the cat is unblocked, it's gonna be okay. Moderate to severe plus arrhythmia, mainly the levels of potassium are increased, and in that way you have to use a cardiac protector like a calcium gluconate and this dose. And you have to remember, you have to apply it slowly, and all the time you have to check the ECG, okay? Because when you use this product, can produce arrhythmias. And when we have a severe arrhythmia, we can use insulin, okay? We have to remember that the insulin produces the shift on the cell, the glucose, extra plasma glucose inside of the cell, and at the same time can produce that the potassium goes at the wrong side of the glucose. I am not used to the CRI, constant rate infusion, because all the cat present so much hypoglycemia and you have to control more. And when I did my residency, we used to use this protocol of insulin and glucose in cats, okay? And this protocol don't produce so much hypoglycemia, and so you can be more quiet. And when the cat presents severe arrhythmia and marked acidosis is when we use bicarbonate. When we use the bicarbonate, that is not common. If I remember all my cases, probably I have used it twice, okay? One during my residency, and probably 2 years ago where I am working right now, okay? Because the number of the cutoff that you have to consider to apply bicarbonate is when the pH is lower than 7.1, okay? And this is the way when we apply the third of the total dose, and it's low intravenous, and after you add everything to the bottle, and you have to calculate the rate of the fluid. And all the time we must not forget the vomiting. When comes a cat, an emergency, the first thing that when I put the intravenous catheter is put an antiemetic. You can use maropitam to this use, or you can use ondansetron. Probably the ondansetron is my second option. And no use for the vomiting in cats metoclopramide, because the cat doesn't have dopamine receptor in the center of vomiting, okay? And another thing that I have learned in these years is that cat can present hypocalcemia. How many of you measured the total calcium in this cat with fluid? It's not common, because probably before my residency I did it as well, okay? And what's happened with the calcium? It alterates the metabolism. Probably it's because the phosphorylation secondary to the obstruction can influence in the calcium metabolism. There is a PTA resistance or ACE-based abnormality can produce this hypocalcemia. And this hypocalcemia could be mild, that is the most common, could be moderate, and could be severe. And when a cat presents severe hypocalcemia, can be very dangerous for its own life, okay? What sign we can observe when a patient presents hypocalcemia? Stiffness, tremors, seizures, hyperthermia, and in that way we have to treat. When we have to treat a hypocalcemia, there is not currently a cutoff, but the cutoff that you can read mainly is when the ionic calcium is 0.7, okay? Even if the cat doesn't present any kind of clinical signs, okay? And this is the dose of calcium gluconate that we use for treating the hypercalcemia. Catheterization. I am lucky because I work with diplomates in anesthesia, so they, or all the group anesthesia, prepare all the cuts or the protocol for anesthesia, but this is the main protocol that we use where I am working right now in Aripura, Valencia Sur. And another thing that if you are very good doing block, you can do the sacrococcygeal block. I am internist, so I have never done this. I have no experience doing this. But with the block can allow to gain time, and the urethra is dilated just a little bit and be more easy to catheterize the cat. Okay. There is another thing, like they use the intravesical atacurium. There is only article from the JSAP, and in this article was demonstrated that when the people has not experienced catheterizing cat is more quick doing it. Okay, but I have no experience with atacurium, and more important, all the time sedate the cat for make the catheterization, because if the cat is wake up and you any movement can produce tears in the urethra, and that's predisposed to stenosis. Okay, and catheterization. Some people save all the penis area. I save all the penis area. Some people don't do it. And wash the skin, for the skin and the blood with chlorhexidine, that's the same that we use for the surgery. And place, all the time I place socket gas with warm water and make over the penis in that way, okay? That produces mainly that if there is a plaque inside of the urethra, is liberate, okay? And when you do some contraction or compress the bladder, sometimes it can jump on the wall and start the cat to urine. And make this movement after to put the gas, you do the movement from the base of the penis to the top of the penis, okay? Rolling the penis, and sometimes you can see, like in this picture, that the plaque start to go out from the penis, okay? What's happened with the cystocentesis? How many of you do cystocentesis in this case, like protocol? Grab your hand. Okay. What's happened? You can do it, okay? Even there is only this abstract evaluating what's happened in this cat when you do the cystocentesis. What's happened? That the cat can produce uroperitoneum, but without clinical sign. It's like a small uroperitoneum, and it's present even in 15% of cases when you do the cystocentesis. When I do the cystocentesis, when I can unblock the cat and I need to gain time, and try to do it my objective is try to leave empty the bladder totally, to try to gain time, and again the filtration glomerular ratio increase, and that way can allow to decrease the level of creatinine, okay? But I am usually not use the cystocentesis because we try all the time to catheterize the cats quickly. Which kind of catheter we have to use? Yeah, you can see a lot of them. I prefer this one, okay? It's Mila, it's the trademark Mila, and this is soft or smooth catheter, and it's more expensive also, but it's the best option to try to decrease the traumatism of the bladder when you have treating this cat. And the most famous catheter is this one, the Tomcat catheter, and this one is very rigid and sometimes increase the the irritation in the urothelium, and that can increase the number of recurrence. Even has been studied that the diameter of the catheter influence over the recurrence. Well, if you use a small catheter, it's better for the cat and reduce the number of catheter, the recurrence, sorry. I try to use all the time this gel to try to lubricate the urethra, and this kind of suture is the ophthalmology surgery to try to not traumatize so much the percussion. And when we do the catheterization, you have to try to more parallel to the spine, the penis, and it's easy because we have to remind that the cat had present a little deviation. Is not so marked like dogs, but this deviation can be more difficult or can difficult the catheterization of the cat. One of the things you can use is this kind of catheter, mainly to do the flush, okay? And I do all the time with with the same catheter. I do the flushing, okay? And more important, try to do everything more sterile possible, okay? Because you can introduce any kind of infection over the bladder. Well, how many times we have to maintain or remove a catheter? Mainly is 24 hours to 36 hours. When the exothermia is resoluted, when the resolution of the post-obstructive diuresis, that is a little bit hard as well, because sometimes some cats are polyuric after 5 or 7 days after they have been unblocked. Clear when you see a clear urine, and all the time remove the catheter under sedation. What I do when I sedate the cat, I take out the catheter, and before they take out the catheter, introduce some warm fluid, and after take out the catheter and compress. I press the urethra to be if the permeability of the urethra, and sometimes you can see that pull out urine without any problem. In that way is when I say, okay, 4 hours more in the hospital, 6 hours more, and I do the discharge. What's happened with the urine culture of the catheter on a cat or in the back, collective back, is not necessary. Before, that was a recommendation in the 2000, I think. There are 2 studies, but right now, according to the new guides for the antimicrobial drugs, it's not recommended to do a culture or bacterial culture in a cat when you take out the catheter, because you can find contaminated flora inside of the catheter or even in the collecting bag. Okay. When I see this image in cat, or I see so much crystalluria like sand, the question is necessary to make flushing in the bladder, and this to study there is not find any kind of difference when you do the flush in cat and a cat you don't do it. The recurrence is the same, but I still do it because I think the cat is more comfortable, because when you have a cystitis and you have that kind of that number of erythrocyte, probably is irritable for the urothelium, and that can be not so good for the cat. At the same time, I think the same when you find this kind of crystalluria or marked crystalluria. So I do the wash or flushing the bladder to see the urine more clear. Another thing very important that I forget to mention is never to use prophylactic antibiotic, mainly right now, because fighting, or we are fighting or mainly for the resistant bacteria. So for that reason, don't use prophylactic antibiotic. If you use adequately managed of the closed circuit of the urine, you don't need to use antimicrobial. For that reason, we use, with a catheter, we use this when I connect the fluid, and you can use collecting bag, or even the bottle of the fluids, okay? But very important to maintain a closed circuit, okay? That is not recommended, or open circuit is not recommended, but because that predisposes many times to a UTI acquired, and this UTI can be multi-resistant if this cat is infected in the clinic. Okay, we're gonna talk about the treating of the feline idiopathic cystitis. This is a table that shows us the evidence. Okay, the strong or high evidence is the evidence type 1, and the lower or weak evidence is la number 4. Okay. What is important to consider when we see a cat with the fair time and not obstructive FIC, that this disease is self-limiting, mainly in female cat. Okay, even if you don't try anything, the cat improve alone. Okay, but we're gonna talking about the treatment in this cat. Analgesic or anti-inflammatories. Mainly, there is not so much evidence about the use of the opioid or synthetic opioid in cat. Mainly because all the study is even uncivic, I think, to leave a cat without any kind of painkiller. Okay, what is the best option in cat is use the buprenorphine to this dose. You can use mainly every 8 hours is the recommendation, and the best way to apply it is intravenous or transmucosal. Okay, even if you inject the cat subcutaneous or intramuscular, is less effective than transmucosal. Okay. Another analgesic you can use is butorphanol. I have not experience, and you have to remember that butorphanol is mainly depressive, or produce mainly depression more than the painkiller. And fentanyl, I have not experienced fentanyl in cats, and all the time we have to remember that the patches of fentanyl, what's happening is the cat eats the patch of fentanyl on a huge intoxication. So I don't recommend to use the fentanyl. Okay, what's happened with the meloxicam? How many of you use meloxicam in this patient? Okay. What's happened with meloxicam? There is 2 studies. Okay, and this study, one of them was using only for 5 days. Okay, the meloxicam only for a short term of medication, and another one was using for 2 weeks. This is a long-term medication, and they both study didn't find any kind of significant difference when you use the meloxicam. Even you have to be very careful when you use meloxicam, because when the cat count is dehydrated and you use meloxicam, you can induce an acute kidney injury. So I don't use meloxicam maybe in chronic cases of recurrent disease. Okay, and the prednisone, there is another study very old, and that evaluates between comparison about if decrease the number of days that the cat is hospitalized in comparison when you use it, and there is not a significant difference between them. So they use the prednisone in these cases is not recommended. What is the new era? Mainly is about the gabapentin and pregabalin. How many of you use these kind of drugs in cats right now? Okay, I think it's a very good option, because when I have talking about the pathology, I was talking about the neurologic pain, and what do these kind of drugs, gabapentin and pregabalin, are very good option. So I am waiting the study to try to use it. I have used it off-label because I don't have the evidence as well, but in my experience, I have used it in 2 cats with a recurrent sign, and they're gonna very well. So I think that is good. They are gonna very good option in the future. Antispasmodic. Okay, when I see or when we read about FIC or fluid, all paper, all book recommend to use a prazocyte. What's happened right now? What evidence we have? We have these 2 evidence that the prazocyte right now not working. I mean, not decrease the number of recurrence the first month that the cat is treated, or the first days the cat is treated. That is very recent investigation, but if you read the material and method, and that is very important when I read an article and try to teach to my resident this, because the dose that they use, even was in this one, if I remember, the dose is adequate, but twice a day. The most recommendation to use the prazocyte is 3 a day, okay? And this another study, and I think that they do the same twice a day. So this study say that doesn't work the prazocyte, but I am still using because I need another study when the dose and frequency adequate that this drug is recommended. So we have to read all the publications with a little bit care, okay? And another kind of antispasmodic drug is the phenoxybenzamine. Here you have phenoxybenzamine. No? No. Okay, because I think it's disappeared in Europe, but it was a very good option. Okay? And what's happened with the stratum musculature? Sometimes you can use diazepam. Diazepam you can use mainly in the recurrent cases or chronic cases. Okay, but have been proved the oral form of the diazepam, and this oral form can produce liver necrosis. So have to advertise to the owner about that. Okay. And another stratum musculature antispasmodic is the alprazolam. I have not experience with them, but you can use it, okay? Another thing that you have to consider is the multimodal environmental, mainly stoy, play routine, food distance from the litter, water distance from the litter, scratching post like a cat tree, elevate observation site, hiding places, this is like cat color, okay? And this is lenga, and litter tray care, frequent cleaning, preferred type of litter. Some cats choose is litter or the substrate of is litter that they prefer. Water fountain and 1 litter box plus the number of cats that you have in home. That is very important to decrease the stress. Okay. When you use the fountain, you have to try to do it by step exchange, and you have to put the bowl and the fountain, and the cat has to choose which one prefer. And maybe the cat delayed 1 week, 2 weeks to prefer one of them. Okay. And then again, we have to study about the fountain in cat, and this study doesn't prove that decrease the specific gravity. What happened? The design again. This study evaluates 36 hours for fountain and different fountains, and this one was less than 7 days. So probably the time the cat is not just used to, or they couldn't elect which one prefer. Wet diet is very important. Before I mentioned a lot of the diet that we have in Affinity Advanced, and this is have evidence law 3 because decrease the recurrence when you use wet diet. In 1 year is the 11%, because when you use dry diets the recurrence is higher. Okay. We have to try to decrease the specific gravity lower than 1.40, and you have to try to, the cat again choose, is the cat prefers the dry food or the wet food, and we can make, or the owner can make the effort to do only wet food. That would be amazing. But remember, all the change, the water bowels, or when you change the diet, can produce stress, and the disease recurrent. What we know about the feline facial pheromone? We don't have evidence. The evidence that exists is only with the anxiety. They decrease the anxiety, so we don't know exactly what's happened with this cat with FIC. Okay, so when I recommend the use of facial pheromones only in recurrent and chronic cases. What's happened with the glycosaminoglycans? All the time I think the pills are so big, and sometimes it's very difficult to medicate the cat. And this medication can produce stress in the cat and even produce recurrence of the clinical signs. So the evidence is totally weak currently. So I recommend mainly in chronic cases. And there is another nutraceutical supplement like antidepressive or natural antidepressive that's coming from the dairy products, and there is no evidence about that this working or not in the FIC. And again, I use only in recurring cases, on chronic cases, and most of them is combination with glycosaminoglycans. But remember, if the medication stress the cat, it's better don't give it, or give him. This is, we have more evidence. In the chronic cases, we know that probably this cat is totally stressful, so we can use tricyclic antidepressant, and the main is the amitriptyline. Okay, this is anticholinergic, antihistamine, antipatholytic, analgesic, anti-inflammatory, and all this work have remembered the pathophysiology. So this is a good option for recurrent or chronic cases, and we have evidence that this medication works. Another medication that there is low information is clomipramine. I don't have experience with them. And the amitriptyline can produce side effects: sedation, the first date, you start the medication, apathy, weight gain. You have to remember the obesity can produce FIC, and urinary irritation. And it's better this cat is all the time, or when the frequency urination is increased, it's better that is low the frequency. And the response to this medication is delayed, okay? The cat needs almost 1 month to see any benefit of this medication. What's happened if we use in acute cases? Because would be a good option, because according to the pathophysiology could work. But this study that was published recently, they find that in the short term that you use the amitriptyline, even if a study level 1 evidence, doesn't work. So only use for the chronic cases, okay? When we use the chronic or long term this medication, we have to decrease the dose when we use prednisone or glucocorticoid, okay? Slow by slow, okay? In 2 weeks. And finally, there is some surgery, okay? One of my mentors all the time tell me that if the cat finally we have to do a surgery, I have not do a good management of medical management of the cat. So I try to avoid this one all the time. well, what happened is sometimes some owner tell you, this is the last time that I can pay this recurrence of the clinical sense, so I'm gonna euthanize in the future. So in these cases, I say we have to do the surgery. And the surgery has adverse events or consequences. Many of the consequences can be recurrent and chronic. When you apply the surgeries in recurrent and chronic FIC, you can use it in recurrent urolithiasis. And even in a recent publication, the owner satisfaction was very high when you use this surgery. And this is how the surgeons do the surgery, because I don't know, because I am a journalist. And this is another way to do ureterostomy. This is called transpelvic ureterostomy. Have never done in any cat this kind of surgery, but mainly you can use when there is a traumatic event of the urethra or tears. Vale? And this one is the prepubic ureterostomy surgery. I don't know if you have experience with this surgery. Okay, I have done twice in 2 cats and one in 1 dog, and we're going to talk about the complications. Okay, if we see the complication in certain perinatal ureterostomy and prepubic ureterostomy, obviously prepubic ureterostomy have so much high number of the complications, mainly cystitis and mainly UTI. Okay, and the long term, again, the prepubic ureterostomy have higher number of complications in comparison with the perianal ureterostomy. In my experience, these 3 patients I have sent to this kind of surgery because the owner asked me this. It was horrible, okay? All the time present infection and leaking of urine in the first period, dermatitis, so I don't recommend it instead of the owner ask you, okay? And this is a very old table that we show that we are doing a better management or clinical management of the fluids in cats and decrease the number of the ureterostomy. And thank you very much.